Hi everyone. In this video, I'm going to talk about pantoprazole. Pantoprazole is a medication classified as a proton pump inhibitor. It is one of the most widely used medications among the PPIs. Pantoprazole is used in many conditions that are associated with excessive secretion of acid in the stomach. Before using this medication, you should know a few important facts. How it relieves gastric symptoms. How long should it be used? Is it really affecting your bones? If so, what to expect? Does it affect mineral levels? All such facts will be discussed in this video. First, let's see where it is useful. Pantoprazole is used to relieve the symptoms of heartburn that is often associated with excessive secretion of acid in the stomach. It can also be used to treat gastroesophageal reflux disease, where gastric acid refluxes back up into your esophagus. You may have a burning sensation in the chest, especially after eating. You may have a feeling of sourness in your mouth or bitter liquid coming back to the mouth or throat. The symptoms may worsen when you are lying down or bending. Few people may also experience some shortness of breath and difficulty breathing. Pantoprazole can control these symptoms by reducing gastric acid secretion. It can also be given to you to treat erosive esophagitis. The symptoms include burning pain and difficulty swallowing. It may also produce belching, nausea, and vomiting. Pantoprazole can also be used for the treatment of both peptic ulcers and gastric ulcers. Helicobacter pylori is a bacterial infection that causes ulceration and inflammation in the stomach. Pantoprazole may also be a part of the dosage regimen in the treatment of Helicobacter pylori infections to control excessive gastric acid secretion. Zollinger-Ellison syndrome is a rare gastric condition where tumors may cause excessive gastric acid secretion. Pantoprazole can be used to control the symptoms associated with this syndrome. If you have uncontrolled hiccups due to GRD, again pantoprazole may be given. How does it work? Pantoprazole binds to one of the pumps on the gastric parietal cells called the proton pump. It is nothing but the H plus K plus exchanging pump, which works by expenditure of energy. This pump is responsible for the release of protons from the gastric parietal cells for the exchange of potassium. This proton then can combine with chloride ions to produce hydrochloric acid. Pantoprazole selectively blocks this pump, thereby inhibiting a secretion of protons and reducing the secretion of gastric acid. This relieves the symptoms of gastric acidity and GRD. How to take this medication? Pantoprazole is available as delayed-release tablets and even granules for oral suspension. Do not chew, cut, or crush pantoprazole tablets. Pantoprazole should not be used for immediate relief of heartburn. You may notice at least 1 to 4 days for significant relief of symptoms. You can take antacids if you have severe symptoms of gastric acidity. Pantoprazole tablets may be taken with or without food. In the case of pantoprazole oral suspension, you can take it 30 minutes before a meal. This medication can be used for the treatment of erosive esophagitis associated with GERD. It can be given at an initial dose of 40 milligrams per day for 8 to 6 weeks. Pantoprazole can also be used for the treatment of both peptic ulcers and gastric ulcers. For peptic ulcer disease, it can be given at a dose of 40 milligrams for 2 weeks. For gastric ulcers, it can be given for up to 4 weeks. For Zollinger-Ellison syndrome, it can be given 40 milligrams per day. The maximum dose is 240 milligrams per day in this condition. Precautions. When you use pantoprazole for longer periods, such as greater than 1 year, it may have few effects on the magnesium. This medication can produce hypomagnesemia, the decreased levels of magnesium in the body. This may result in a few symptoms like fast or skipping heartbeats, dizziness, and muscle spasms. In severe conditions, it can induce cardiac arrhythmias and seizures. Magnesium supplements cannot completely restore this condition, and this hypomagnesemia can also lead to hypocalcemia, a decrease in the calcium levels, or hypokalemia, a decrease in the potassium levels. Therefore, it is very important to check the mineral levels when you are using the proton pump inhibitors for longer periods. If you have any pre-existing conditions that lead to hypocalcemia, again you should use the pantoprazole very carefully. Because in the people with hypoparathyroidism with reduced parathyroid levels, the calcium levels are also reduced. This may further increase the risk of hypocalcemia when they are using pantoprazole. Supplementation with magnesium or calcium may be required in such people. When you're using the pantoprazole for longer than 3 years, you may have symptoms of malabsorption or deficiency of vitamin B12. It may result in sore tongue, weakness, tingling, or numbness in your hands or feet. When you're using pantoprazole for longer periods, greater than 1 year, it may have some adverse effects on your bones. Particularly at higher doses and long-term therapy, pantoprazole can produce osteoporosis-related fractures of the hip, wrist, or spine. Therefore, when you are using this pantoprazole for longer periods, you should be careful. The risk is higher in older adults and people taking pantoprazole for a long time or taking a high dose. Pantoprazole can interfere with a few of the drugs that are co-administered. One such type of medication is clopidogrel, which is going to be converted into its active metabolite by metabolism. Pantoprazole can inhibit this metabolic process, thereby reducing the formation of the active metabolite of clopidogrel. Clopidogrel is used as an anticoagulant. Therefore, in the presence of pantoprazole, the activity of clopidogrel is going to be reduced. Pantoprazole can produce a condition called acute interstitial nephritis. In this condition, inflammation and swelling can be observed in the kidney's interstitium. It may result in a few symptoms like the development of fever, rash, and swelling. Decreased urinary output, blood in the urine, weight gain, and an altered mental status like drowsiness and confusion can be observed. It may be associated with a few symptoms linked with decreased renal function, such as nausea, loss of appetite, and malaise. Even it can produce a few extra-renal symptoms like fever, rash, and joint pains. When you're taking other medication with pantoprazole, it may interact with their concentrations. For example, methotrexate is one of the medications that is used as an anti-cancer agent as well as to treat rheumatoid arthritis. When pantoprazole is taken along with methotrexate, the levels of methotrexate may be increased, leading to its toxicity. Therefore, when you're taking the methotrexate, particularly at higher doses, a temporary withdrawal of pantoprazole may be suggested. Pantoprazole can increase the risk of a few infections. Particularly, it can increase the salmonella infections and campylobacter infections. One of the common incidents of pantoprazole is the development of Clostridium difficile-associated diarrhea. If diarrhea is not improved even after discontinuation of pantoprazole, the diagnosis for CDAD should be recommended. Side effects. Many of the side effects of pantoprazole are mild and well controlled. Common side effects may include abdominal pain, headache, dizziness, chest pain, and edema. Other side effects like diarrhea, pruritus, and rash also observed. That's all, guys. These are the essential facts that you should know about pantoprazole. Thanks for watching this video. If you find any interesting facts on this medication, please share them in the comment box below. Please do subscribe and hit the like button. I will come with another interesting video in the next week. Until then, have a nice time, take care, and goodbye.